Good afternoon, gentlemen of the press. This is a press statement by the Medical and Dental Consultant Association of Nigeria, LUTH chapter, in conjunction with the Association of Resident Doctors of LUTH. Today, the 13th November 2018, at the Consultants Lounge, LUTH in Idiaraba. You are welcome to this press briefing called to bring to your attention the crisis situation within the hospital, the Lagos University Teaching Hospital. For keen watchers of events in the hospital, members of staff, especially doctors, have continued to provide services in most undesiring conditions despite persistent deprivations in our individual and collective welfare. In the past years, we have done all that is within our capabilities to continue service provision with very minimal institutional support, with little or non-existing technological support. This we have done because we understand that, like the economist says, human wants are many, but the resources are limited. And this had, to some extent, we've had to expend our personal resources to support this establishment. You may also recall that the frequency of industrial actions among doctors in this establishment has drastically reduced because of the conscious effort put in place by the body of doctors, being mindful of the collateral damages that comes with such actions. We therefore at this point consider it necessary to alert the good people of Nigeria, and particularly Lagos State, of the brewing crisis in the hospital, which has the potential of eroding whatever gains we may have achieved in the last 3 years. As we speak, there appeared to be an orchestrated plot in some quarters to accelerate or generate the crisis. This is because doctors in the employ of the Lagos University Teaching Hospital were last paid their monthly salaries in August 2018, while other workers in the hospital have been paid up to date. And having sought explanation for this discriminatory payment, both the management of the hospital, the Federal Ministry of Health, and the Federal Ministry of Finance had given conflicting reports. As at Monday, the 5th of November 2018, in Abuja, there was no official steps taken so far to ensure that this problem is attended to. What then is expected of a young house officer who by the end of this month will be owed 3 months' salary? The resident doctor whose families rely upon their welfare and who also has his examinations to finance? Or are the consultant expected to carry on as if all is well when he is aware that all other workers in the hospitals, including the officers of the hospital management, have all been paid, while he is left to the blame trading acts of government officials? We are therefore using this medium to call on and also appeal to the officials of the federal government in the Federal Ministry of Health and Finance to save the country and the government further embarrassment, as well as the country, of the outcomes of actions which overtly provokes men of the noble profession whose welfare and dignity is being threatened. There's a limit to which this level of discrimination can be tolerated. The word is enough for the wise. Well, it's one of the many steps we're taking to avert an impending crisis in the hospital. Doctors in this institution have been discriminatorily treated in remuneration for the services they have been providing. The last time doctors were paid in this hospital was in August this year. While we thought the delay in September was the usual thing we had always experienced, we were shocked to know that October ended and we still had no hope of being paid our salaries. Among this category of doctors are pre-registration house officers who for 3 months have not earned a dime. And they are aware that every other staff in the hospital, apart from the doctors, have been paid and are still being paid. There is no evidence or no signpost to tell us that doctors will be paid at any particular time in the course of the year. The information that we've received so far has not given us any assurance that this will not continue to the end of the year. We had experienced the same in the last 2 years, and many times we do not get paid till December of those years. I'm talking here about 2016 and 2017. And but this year, the problem seems to have come earlier. Like I said, it started in August. Apart from engaging our management, we had taken a trip to Abuja. We've gone from the Federal Ministry of Health through to Federal Ministry of Finance. And coming back from those places, it does not appear that there is any concrete step to address this problem. And the question is, are we going to sit while our management, as well as the Federal Ministry of Finance, trade blame on who has done the right thing or who has not done the right thing? And so it's on this basis that we thought it necessary to address the people whom we serve, the people who are beneficiaries of our services, and those who we think we are accountable to, apart from our employers. Because the cost of any action that may emanate from this is enormous. We do not need to tell anyone who had been in this country for the past 4 or 5 years the impact of doctors' strike on the populace. We do not intend to get there if the officers of the government allow reason to prevail. And that is one major reason we're here today.
This press conference has been called at the instance of the lingering crisis that is about to explode in LUTH, which is a fallout of the 3-month salaries that is being owed. The last time resident doctors and house officers earned salary in this hospital was in August this year. And then we are hoping that this crisis will be cut short to avert any undue collateral damages. The last time we earned salary was in August 2018. So we've not earned September salary, October salary, and this is mid-November. And then there is nothing in sight that seems like this salary in November is going to come anytime soon. So coupled with the September and October, we are talking about 3 months, and this is a long suffering, on the populace of doctors in this institution. I can also not imagine the reason why a worker will be owed his wages. Because for all I understand, the simplest ways to remunerate a worker is pay his minimum, allowances, that's salaries. And up to now, up to this moment, there is no reason advanced for non-payment of our salaries, even though what we have had from different quarters is issue of budget that is not being enough to continue payment of salary for this month, which is not the first time that it is happening. And we would have expected that anticipatory measures will have been put in place to forestall this delay in payment of salary this time, because we cannot continue to be doing same business same way and getting negative results every time, year in year out, and we still remain at that level. I hope we're supposed to be dynamic people, but I can't see the dynamism in us, with the issue of remuneration and welfare of doctors, people who, strive hard to serve the population. Way forward, which I think will be ideal, is for prompt payments of salaries that were owed. Way forward will be to quickly, from every quarters, resolve the issues of unpaid salaries. That is from the end of the government. Because for us, there is no way forward. All we want is pay our salaries and then normalcy continues. Because up to this moment, there has not been any discontinuation in service in this hospital, at least in the last 1.5 years, from the ends of the resident doctors. And we do not wish to have any discontinuation in the course of this year and beyond. And for that reason, we want prompt payments of salaries. And if this does not occur, as has been, as we also know that in many occasions in Nigeria, what is understandable to government and government agencies is industrial strike action. But we hope and wish not to get to this point. But however, If this situation persists, we may get to this point.